Today we are going to learn about acute osteomyelitis. Now in the word osteomyelitis, osteon means bone and myelitis means infection of the marrow because the primary infection occurs in the bone marrow. Acute here means that the infection has taken place recently and it is usually of less than 2 weeks. Coming to the causes of osteomyelitis, there can be a primary cause in which the infection has reached the bone through the hematogenous or through the blood. This comes from a different infection in the body which travels to the bone through the bloodstream. In the secondary causes, the examples are open fractures and surgery. In these cases, the infection is implanted into the bone directly. For example, in case of an open fracture, the wound is exposed to the external environment and the infection is seeded into the wound while the injury takes place. Another example is while we are performing the surgery, the infection can be inoculated inside the bone directly through an instrument. Now, to understand the infection of the bone, first we should understand the anatomy of the bone. The bone has a long diaphysis which connects the two bulbous ends of the bone. These ends, the extremes of these ends are called the epiphysis. Then next to it is the growth plate where the growth of the bone occurs. The area next to the growth plate and between the diaphysis is called the metaphyseal area. This metaphyseal area is very important in understanding the pathophysiology of bone infection. Now this diagram shows the end of the bone. This part is the epiphysis. This greenish part here is the growth plate and just below it is the metaphyseal area. Now this area shows blood vessels. These are the arterioles which are coming and forming hairpin bend loops which are connected to the outgoing vein. These areas are called the hairpin bends which form an end loop and causes vascular stasis. Vascular stasis means the blood comes here and slows down in these areas. If the bacteria is coming through the arteriole, it will get trapped into this area which will cause bacterial stasis. Thus, the bacteria will collect in the metaphyseal area and form a foci of infection. Now we will talk about the bacteria which are most commonly found in these bone infections. The most common organism which is found in the bone infection is the Staphylococcus. Here Staphylo means a structure like a bunch of grapes, and the cocci or coccus here means that the bacteria are round in shape. Now these round bacteria form a structure like a bunch of a grape. That is why they are called Staphylococcus. Other bacteria which cause acute osteomyelitis of the bone are the Streptococcus. Here strepto means chain and cocci means round bacteria. These bacteria exist in linear chain like forms. The third most common is the Pneumococcus, which is an encapsulated bacteria. If we talk about the most common site of the bone infection, the most common site of bone infection is the distal end of femur, followed by proximal tibia. If these both are combined, we can call that the infection most commonly occurs around the knee joint. The other regions which are commonly involved are the proximal femur, which is near the hip joint, and the proximal humerus, which is near the shoulder joint. Now we will talk about the pathophysiology of bone infection. The bacteria which has accumulated in the metaphyseal region of the bone will cause an inflammatory response, due to which inflammatory exudate will be formed in the bone. Now what is inflammatory exudate? It is nothing but dead cells. The neutrophils come and try to engulf the bacteria and decrease the spread of infection. They die in the process and they form the inflammatory exudate. These dead neutrophils and the debris or the leftover of this process forms the pus, which accumulates inside the bone and it spreads through various channels. Now this pus which has been formed inside this bone has to go outside through various channels. The pus can spread inside the medullary cavity and involve the whole of the bone. It can break the outer cortex of the bone to lie under the periosteum to form a subperiosteal abscess, or the bone can be eroded and the adjacent joint which is near this bone can be involved to form a septic arthritis like condition. This condition can be seen commonly in the knee joint, hip joint and the shoulder joint. Now what will happen if the pus gets accumulated in the medullary cavity? It causes thrombosis of the vessels inside the medullary cavity. This pus also goes outside the cortex by eroding the cortex and lies below the periosteum. This causes damage to the periosteal blood supply also. Now the bone does not have any blood supply because the blood supply which is coming from inside is also gone, and the blood supply which was coming through the periosteal blood supply or the outside blood supply is also gone. This separated piece of bone is devoid of blood supply and will later form a sequestrum when the condition will be turned into chronic osteomyelitis. Now what happens to the pus which has lifted the periosteum? If the periosteum bursts, then this pus comes out in the submuscular plane and causes an abscess. If this abscess further pierces through the skin, then the pus comes out through the skin and forms a tract. This is called a sinus. The periosteum which was lifted. So common clinical findings seen in acute osteomyelitis can be an abscess or a sinus formation. The periosteum which is lifted, and if it has not burst, then new bone formation can occur in this lifted periosteum, which is seen as the periosteal reaction on the X-ray. Now we have to understand that if the metaphyseal region is inside the capsule of a joint, then this abscess can easily spread inside this joint and cause a septic arthritis. I will make a separate video for septic arthritis. And the common joints which are involved in this condition are the hip joint and the shoulder joint, because the metaphyseal region which is involved lies inside the capsule of these joints, and if the pus is formed in the metaphyseal region, then it breaks through the cortex to enter the joint and causes a septic arthritis. Diagnosis of a patient with acute osteomyelitis. This condition commonly occurs in children with a propensity of more male patients as compared to female patients. It is an acute onset condition which causes pain and swelling in that area which is involved. Systemic feature involves high grade fever. On examination, the child will be febrile and dehydrated. Locally, one can see signs of inflammation in that area, which are the redness, increased temperature, swelling and tenderness. An abscess can be found in the area which will show fluctuation. Now it is not necessary that if you find a joint effusion, it is a septic arthritis in acute osteomyelitis. Sometimes the nearby joint has just an effusion which is non-infective and it is due to sympathetic activity. It is called a sympathetic effusion. What investigations you will order? A complete blood count which will show increased number of neutrophils and an increased total leukocyte count. ESR will be raised, CRP will be raised. These are markers of infection in the body. One should always send a blood culture whenever a patient comes with fever to find the causative organism. Bone scan is one of the modality which helps in early detection of the infection using technetium 99, but most specific for infection will be a scan using indium 111. Now, what are the differential diagnosis? We have already talked about septic arthritis. Septic arthritis is involvement of joint, and acute osteomyelitis is just an involvement of bone by infection. Then there can be an acute rheumatic arthritis in which the joints are swollen and the child will not be able to move his limbs. It can mimic the condition of acute osteomyelitis. Scurvy will be a similar situation. Acute poliomyelitis in which the child will not move the limb, and we have a suspicion of both infection and weakness. Now, what are the complications? The most common complication will be conversion of this infection into a chronic osteomyelitis. The bone will have the infection for long time, and once it is there, it is very difficult to eradicate the infection. The patient can develop acute pyogenic arthritis in case the pus finds a way into the joint. There can be a pathological fracture because the bone has lost its strength due to involvement of the structure. Anytime it can break. Due to disturbance of the nearby growth plate, there can be growth disturbances which can be both a shortening of a limb or an increase in the growth of the limb due to hyperemia near the growth plate. Hyperemia is increase in blood supply. Now, how will you treat these patients? It is a simple algorithm. If the patient presents within 48 hours, then rest and rehydration of the patient is done. Antibiotics are given. Now, how do we give antibiotics in these patients? 2 weeks of intravenous antibiotics followed by 6 weeks of oral antibiotics are recommended. If the patient presents after 48 hours, then a USG is mandatory, and we should look for development of an abscess in the intramuscular plane as well as the bone, and surgical drainage is important in these patients. It is a rule, if there is pus, you have to let it out. Now, the pus can be drained by just an incision if it is present just inside the intermuscular plane or between the muscles. But if it is inside the bone, then the procedure involves drilling of the bone to decompress it. By decompression here we mean that we form a way by drilling through which the pus will come out. And even after drainage, treatment remains the same. We have to give antibiotics for 2 weeks intravenously followed by 6 weeks orally.